We continue our discussion on diabetes. In the previous lecture, that is diabetes part 2, I talked to you regarding types of diabetes, type 1 and type 2, which are traditionally discussed types of diabetes. Now, but there are many more also. So let's talk about other types of diabetes. So one of them is maturity onset diabetes of young. It is an autosomal dominant condition. This is a very important point. So that means in this case the family history will be definitely positive. Why? Because it is autosomal dominant. Point to be noted that in type 2 diabetes we have a strongly positive family history, but here we have a definitely positive family history. And it's again one more thing, it's a type of type 2 diabetes, but it usually affects the young people. Point to be noted. Remember one more point to be noted, normally type 2 diabetes occur usually above the age of 40 years, so called elderly people, but this is an exception. It's a kind of type 2 diabetes which is occurring in the young people. Very important point that you got to note it. Now what is the basic problem? There is an impaired glucose induced secretion of insulin. Beta cells are not able to sense glucose. This needs discussion. Let's learn the basic concept about this. What is this? This is the normal, let's say this is the pancreas, and here we have a beta cell, and the beta cell has insulin. Normally glucose comes, G for glucose, it acts on the receptor and that lead to secretion of insulin, normal physiology. So in beta cell they sense insulin, they sense glucose and they secrete insulin. But here glucose comes, but this sensitivity of beta cell to glucose is reduced. That means glucose has already come to the receptor, but still it is not able to release the insulin, right? So what treatment we give? Sulfonylurea, low dose. Why we give sulfonylurea? Let's learn the basic concept about pharmacology of sulfonylurea. Sulfonylurea normal action is it come to beta cells, it act on the surface membrane of beta cell and it causes release of preformed insulin. And this action of sulfonylurea is known as insulin secretagogue. That means sulfonylurea causes release of preformed insulin. So what we learned, a new term is secretagogue, insulin secretagogue. So if I ask you which is the naturally occurring insulin secretagogue, the answer should be glucose. Am I right? So sulfonylurea is doing the same job what is done in a normal person by glucose. Now in these patients, in MODY, maturity onset diabetes of young, this secretion ability is reduced. That's why we use it in the treatment, we use low dose sulfonylurea. Point to note it, beta cells are normal in these patients. There is no problem in the beta cell as such. There is no peripheral resistance to insulin. Why it is so important to write this line? Because I told you it's a type of type 2 diabetes. Usually in type 2 diabetes, this is another major problem in a traditional type of type 2 diabetes, but here there is no peripheral resistance to insulin. Well, then there are 6 types of MODY, except for type 2, which is due to the glucokinase gene defect. All other are due to mutation in the hepatocyte nuclear transcription factor, so called HNF. This is the mutation occurs in this, and this regulate islet cell gene expression. Okay. MODY 3 is the most common type. It accounts for 2/3 of MODY cases, and this is due to HNF1 alpha mutation. Again, this is a very important point, you got to remember it. Now what are the features of MODY? Remember I said kind of type 2 diabetes, but still remember there are no autoantibodies. This one point which differentiates from type 1 diabetes. Remember, it is occurring in the young patient. Even type 1 diabetes occur in the younger patient, but have no antibodies. No obesity. Again, remember, it's a kind of type 2 diabetes, but obesity is not a feature. Remember, a traditional case of type 2 diabetes, obesity is a very important feature. DKA is uncommon. Remember, DKA is very common in type 1 diabetes. Insulinopenia, serum insulin level is reduced. By this, it resembles type 1 diabetes. But there is no hypertension, no insulin resistance, no dyslipidemia. These three are very common in type 2 diabetes, but these are not seen in MODY. And treatment of MODY is, I told you, low dose of sulfonylurea. The reason being, sulfonylurea is an insulin secretagogue. Now, let me tell you the difference between type 1 and type 2 diabetes. Age usually below 40 years and usually below 25 years. Okay. Family history may or may not be there, but here it will be definitely will be there. Reason being, it is an autosomal dominant condition. Autoimmune, yes, no. We know very well that type 1 diabetes, a good amount of patients they are autoimmune, but just to remind you, there are few people who belong to type 1 patient who have no autoantibodies, also what we call a type 1b diabetes. Body weight usually normal or maybe little underweight also, and for normal, and they are usually normal. Beta cell sensitivity to glucose, it is normal, it is reduced. Insulin level reduced. This is common between the two. In both, this insulinopenia is there. Insulin antibodies, yes. Why? Because autoimmune are there, and there is no autoimmune, so there is no chance of having any antibodies. Treatment, we give insulin, I for insulin, and here we get low dose of sulfonylurea as discussed earlier. Insulin resistance, no, there is no resistance regarding insulin, which is a feature of adult onset type 2 diabetes. With this background, we move into second type of LADA, latent autoimmune diabetes of adult. Well, traditionally when we talk about type 1 diabetes, what they say, it is in children or below 40 years, some people write it. If you read any book of 20 years back, type 1 diabetes, type 2 diabetes, below 40 year, above 40 year, or they will say young, or they will say elderly. This is what they used to write 20 years back. Now they say type 1 diabetes usually, they have added the word usually and usually. Why this is usually? Because most of the time patients are above 40 years in type 2, but I just discussed just now, MODY is a kind of type 2 diabetes which occurs in young patient. Similarly, we can get type 1 diabetes in elderly people also, what we call as LADA. So let me explain to you. Suppose you are sitting in your OPD right now. A 70-year gentleman walks into your OPD and he say, "Doctor, I am diabetic for last 1 to 2 years." So obviously you will think about type 2 diabetes, 70 year. But now, this even at the age of 70 year, a type 1 diabetes can occur, so called LADA. So what we can say, LADA is nothing but a kind of type 1 diabetes occurring in the elderly person. They have all the features like autoantibodies. In this case, definitely serum insulin level will be reduced because it's a kind of type 1 diabetes. So in nutshell, summary, LADA is nothing but type 1 diabetes in elderly is LADA. Now there are certain drugs which can cause hyperglycemia, and the most commonly used drug is corticosteroids. They lead to hyperglycemia. And then the other common drug that we use is thiazide diuretics. They can lead to hyperglycemia, well known and very frequently asked questions. The other drug is nicotinic acid, something very interesting. This drug we use for hyperlipidemia, but it can lead to hyperglycemia also. Phenytoin, alpha interferon, protease inhibitor, beta agonist, clozapam, but you don't have to forget these three things. They are the three most commonly asked questions in the exams. Well, then the fourth cause of hyperglycemia is pancreatic disease surgery. If pancreas has been removed, more than 70% of the pancreas has been removed due to any reason, due to any disease, that can lead to hyperglycemia, or pancreatic trauma can lead to hyperglycemia. Pancreatic destruction, this classically occurs in hemochromatosis. Cystic fibrosis, these two are very, very important questions, especially hemochromatosis, what we call as bronze diabetes. Why? Because the excess amount of iron which get deposited in the skin gives a brown color to skin, and due to destruction of beta cell it leads to diabetes. So we call it bronze diabetes in hemochromatosis. It's a very, very important question for you. Well, before I proceed further, I have a very simple question for you. Well, in hemochromatosis, patient can have some pain in any big joint. Tell me which joint is involved most commonly in hemochromatosis and what is the name of the disease. You can stop the video, write down the answer. Well, I am sure you have written the answer. Answer is pseudogout. The most common joint involved is knee joint. This extra knowledge, this is very, very, in fact this itself is a very important question for this topic is very important for the exam. We proceed further. Pancreatic cancer can lead to diabetes, hyperglycemia. Fibrocalcinosis pancreatopathy, also called tropical calcific pancreatitis. They can lead to diabetes. About this I will be talking little more detail little later on. Now there are certain other endocrine conditions which can lead to hyperglycemia. Condition like acromegaly, condition like pheochromocytoma, condition like Cushing syndrome, condition like glucagonoma, condition like somatostatinoma. But this very frequently asked question. But one condition where hyperglycemia is usually not a feature is Addison disease. Here hypoglycemia occurs. Okay. Then we have a potential diabetes. What is this? Let's learn the basic concept. Suppose you are sitting in the OPD and you get one patient who just come with a sore throat, little fever, maybe you diagnose clinically as a case of viral fever. You ask him, are you diabetic? He says, no doctor, I am not diabetic. I get my sugar checked every 6 months or a year. I am not diabetic. But he says, but yes, my mom or my dad, either of them or both are diabetic. So we will call this gentleman as a case of potential diabetes. That means the patient himself is non-diabetic but has a positive family history, and this patient we will call as a case of potential diabetes. So I can say in the other way around also, in potential diabetes the blood sugar will be normal, but that patient need to be very guarded and supervised in a periodical way, so that if he develop diabetes, that should be caught in the very early stage. Latent diabetes, patient become hyperglycemic during the period of stress. For example, I get one patient who has got severe bronchial asthma. He come to my OPD and I check his blood sugar. His blood sugar is 90 at the moment, and since he is severely asthmatic, so other than other anti-asthmatic drug, I also prescribe him corticosteroids. We all know steroid can lead to hyperglycemia, and I ask him to come to me after a few days. He come to me after a few days. Now when he come back, I check his sugar. Now his blood sugar is 400. Well, I can make out that perhaps this could be due to steroid induced. Now as patient is clinically stable, so I gradually withdraw his steroid, and again he come back to me after a few days after stopping steroids. Now as I check his sugar is 92 mg/%. It has come back to normal. So we can very well assume that he developed hyperglycemia when he was on steroid therapy. So called his body was under stress due to steroid induced. So we call this as a case of latent diabetes. And classically the same term we use for any lady who is non-diabetic during preconception, become diabetic during maybe pregnancy. Again after delivery she come back to normal. So we call this again a case of latent diabetes, because it was all due to stress induced diabetes. Acute fulminant diabetes, it is sudden onset diabetes, may occur in any age, very important point. It occurs usually after viral fever, okay, and viral infection, they destroy the beta cell. In such cases serum insulin level, I for insulin level is reduced. So there is destruction of beta cell, but serum insulin level is reduced and there is no antibodies. This one point we differentiate it from type 1 diabetes, and this is also supposed to be the cause of type 1 diabetes, which is due to there is no autoantibodies. What the other name of this diabetes is type 1b diabetes. That means patient has reduced insulin level without, and there is destruction of beta cells there, but without any autoantibodies. The common virus which can induce this problem are mumps, measles, Coxsackie, CMV, rubella, and Epstein-Barr. This again a very important question. This you should know. Malnourished diabetes, something very interesting thing is there. It is seen in a malnourished child. So let's learn the basic concept. At times this entity is also included in the tropical diabetes, also they include, but some authority they try to mention it separately. So I am mentioning it separately. What is this? Again, you are sitting in your OPD, a 4-year-old boy is brought to you, a 4-year child is brought to you, who is severely malnourished. The history given to you is that the child has not taken anything for the last 24 hours. Well, you ask for the blood sugar to be checked. What we expect, his blood sugar, you expected his blood sugar to be very low, but when you check it, you find his blood sugar is 400 mg/%. Okay, 400 mg/%. Now you are confused. What is this? We expected hypoglycemia, but he is hyperglycemic. Why he is hyperglycemic? Well, we recall our basic biochemistry and physiology of insulin. We know insulin is made of 2 chains of amino acid, and these 2 chains are united each other by bisulfide bond. Okay, remember they are made of 2 chains of amino acid, insulin. Now this child is so malnourished that he doesn't have enough amino acid to make insulin. That's why in these cases insulin level is reduced, but there are no autoantibodies. Beta cells are normal. And how to treat this case? Simple, give good calories, good protein is so called malnourished diabetes. So in nutshell, reduce insulin without destruction of beta cell due to low protein amino acid in the blood. Brittle diabetes, this is seen in type 1 diabetes in children. What happened? Sometimes sugar is very high, patient can go into DKA, sometimes patient go into hypoglycemia, again very high sugar. So there is wide fluctuation of blood sugar and so called brittle diabetes. Now one question for you, stop the video, write down the answer. We have a term called brittle diabetes. Similarly, we have something called brittle in respiratory medicine also, especially in children. Name the disease where we have brittle something in respiratory disease. Well, I am sure you have written the answer. The answer is brittle asthma. Again in children, suddenly patient go into severe bronchospasm within a couple of minutes. This is due to so called local anaphylactic reaction in the bronchial. So we have two terms, brittle asthma and brittle diabetes, both in children. Now we have tropical diabetes, especially in chronic malnutrition or sometimes chronic pancreatitis. I told you malnutrition also, and many authorities they use as a malnourished diabetes and malnutrition related diabetes also. But what is more commonly is chronic pancreatitis. This is seen in Africa. What happened? These patients they consume cassava, and that produces a picture like chronic pancreatitis. Here patient can have pain abdomen. And the classical finding, when we do the X-ray of the abdomen of this patient, you find pancreatic calcification. And this is so-called tropical diabetes. And again repeating second time, if the malnourished diabetes, which I have mentioned separately, many authorities they include that also in this particular category. There are certain mitochondrial gene defects which can lead to diabetes. Classically is we talk about those conditions like Wolfram syndrome. It is characterized by diabetes insipidus, diabetes mellitus, optic atrophy, deafness, and the mnemonic is DID, MOD. DID MOD is the mnemonic for Wolfram syndrome. Okay, so and genetic defect in insulin action. It could be leprechaunism. Classically, there is subcutaneous atrophy of the fat, Robinson-Mendelson syndrome, and cystic fibrosis. Very, very important question. Now, autoimmune disease, which can be there, especially with type 1 diabetes. Chronic lymphocytic thyroiditis may be a feature with type 1 diabetes, and this entity is known as Hashimoto-thyroiditis. Celiac disease, very often associated with type 1 diabetes, and that's why celiac disease is also known as diabetic diarrhea. Very, very important question. And multiple endocrine deficiency syndrome can have hyperglycemia. So these two things are very frequently asked questions. And now come the recent updates. This total latest update, many of you may be listening for the first time, type 3 diabetes. What is this? Now it is well noted and that Alzheimer's disease is very often associated with, strongly association with type 2 diabetes. So insulin resistance can lead to Alzheimer's disease. The condition type 3 diabetes, seen patient having type 2 diabetes with Alzheimer's disease, this we call as type 3 diabetes. The question is a prospective new questions. Well, the question what they will going to ask you is, what is the name in type 3 diabetes? Type 2 diabetes is associated with which other disease? The answer should be Alzheimer's disease. Or other way around, they can ask you, Alzheimer's disease is strongly associated with disease? Answer should be always diabetes. Well, a quick recap of the last minute revision points. Drug-induced diabetes, steroid, thiazide, nicotinic acid, phenytoin, pancreatic disease, surgery, destruction, cancer, malnourished diabetes, Cushing syndrome, acromegaly, pheoglucoconoma and somatostatinoma, endocrine disease, potential diabetes, positive family history, latent diabetes is stress-induced diabetes, acute fulminant diabetes due to viral fever causing destruction of beta cell without any antibodies, malnourished diabetes because of reduced amino acid, the patient is not able to synthesize insulin, brittle diabetes, wide fluctuation of blood sugar, tropical diabetes is usually chronic pancreatitis due to cassava intake, pain abdomen and pancreatic calcification is a feature, mitochondrial gene defect, DID MOD is the classical example, and genetic defects, cystic fibrosis and leprechaunism. Tropical diabetes is we discussed earlier. Autoimmune diabetes, other condition which can have autoimmune disease which can have diabetes is Hashimoto's celiac disease, and type 3 diabetes is diabetes with Alzheimer's disease. And before that we also talked about MODY, maturity onset diabetes of young, autoimmune diabetes, or sorry, this is autosomal diabetes occur because of reduced sensitivity of beta cell to glucose. And we got LADA, that is type 1 diabetes occurring in the young patient, in the elderly patient, and this is type 2 diabetes occurring in the young patient. Okay, thank you very much for watching this video.